Okay, guys, what's wrong with Obama's gun control medicine? John, we're going to start with you.
No, actually, Sean.
Want to start with you, Sean? Okay. All right, we're going to start with Sean Brodale, DO, Emergency Medicine Physician, Doctors for Responsible Gun Ownership members and promotions, right? We got you. Come on up. Thank you very much. Appreciate it.
I'd like to thank the staff for the honor of being able to speak today, especially among my colleagues here. I first became involved with DRGO after hearing John and Dean speaking with Masad Ayub at the 2014 GRPC, and that got me connected with them and got me here last year and again this year. And something they did that helped me out. I wrote a proposal for a policy for concealed carry in my community hospital in Iowa. And of course, if you know hospitals, they don't want concealed carry in their hospitals, so that got rejected. But it really got me connected with John and got me on the road that brought me here today. One of the biggest things I hate with the medical establishment is their constant gun grabbing, twisting of the truth, and really outright lies in constant attempts to obliterate our right to bear arms. And this goes back, at least as far as 1993, probably further back, when Arthur Kellerman and others published an article titled "Gun Ownership as a Risk Factor for Homicide in the Home," published in the New England Journal of Medicine. And thus was born the 3 times fallacy, where the gun grabbers say that we are 3 times more likely to be murdered in our own home if we have a gun in the home. Actually, the statistics that they quote that they had in their article was 2.7 times, but of course, we all know that there's no need for accuracy when promoting gun control. There's been many counter arguments to this article, but I thought I'd kind of make it simple and just bring up something that I don't hear very much. Table 4 of their article shows 6 risk factors that they used in their analysis. Guess where gun ownership lies? Not on the top, not quite 6, but I have a reason for that. Number 5. It's number 5. And the funny thing is that some of them are, you can understand that. The 4 other factors were, of course, sorry, lost my spot here. The behaviors that were found to be a higher risk, of course, you would expect illegal acts, such as illicit drug use and domestic abuse. But that's not really the kicker, because 2 other behaviors that they found to be a higher risk for homicide in the home, yes, even higher than having the evil gun, are renting the home or living alone. But do we hear anything about that in this constant diatribe and constant stuff that they read back for the last so many years, since 1993? You never hear that. You don't hear anything about promoting home ownership or finding a roommate to help keep you safer in your home. And that's what they've been spouting over the years. Certainly, if I were a researcher, I would have looked at this and go, seriously, guys, we did something wrong here. Because these are common things known to be common in everyday life. And maybe gun ownership is just common in everyday life, and it really isn't a risk factor. The one thing that they did find to be less risky in the home was having a member of the household being arrested. Of course, that takes them out of the household, so that's where it lowers your risk a little bit. So if they truly wanted to do research and they truly wanted to find risk factors in the home, this Kellerman article would be a landmark study against drug use or domestic abuse or even renting a home, but that's not what they wanted to find. What they wanted to find is that the gun was bad. What they were really doing is gun control advocacy research. And this is what Tim Wheeler testified about back in 1995 that encouraged Congress to pass the Dickey Amendment. And certainly that's why Tim is still fighting for our rights here today. And I'd certainly like to thank Tim for all the work that he's done. And of course, he received an award today for that. But for all the work that he's done in that realm. The next thing that's common among the medical establishment is to say that there's an epidemic or a public health crisis of gun violence in the U.S. And a recent press release from the president of the AMA after the Orlando terrorist attack shows that bias pretty clearly. Kind of look at this and say, you know, these guys are doctors and they should kind of know research and they should be able to put two and two together and make a decent conclusion out of that, but really they don't. Here's what the AMA president said after the Orlando shooting. He says, with approximately 30,000 men, women, and children dying each year at the end of a barrel of a gun in elementary schools, movie theaters, workplaces, houses of worship, and on live television, the United States faces a public health crisis of gun violence. Now, he implies, and not very subtly, I might add, by all these places that he cites, which were, of course, you would recognize places of mass public murders in the not-so-distant past, he would imply that all of these 30,000 people were killed by mass public murders. We know this is completely false. In the first place, as has been said multiple times here today, 2/3 of those deaths by firearm are from suicide. And certainly these suicides are an entirely different issue. These aren't happening in public places like he cites. They are alone and they are despondent and they take their own lives. This is the health crisis, but not the one they're spouting, and certainly won't be solved by gun control. The majority of these firearms happen in the streets of Chicago, LA, and other big cities in illegal acts, and not by law-abiding gun owners like us. So the medical establishment has taken up arms against our right to bear arms, and it takes other physicians to speak out against them, and a great leader like Tim Wheeler to get us going in the same direction in order to make a difference. I'm honored to be part of DRGO, certainly be honored to be here with all of you, and honored to be part of anybody who fights for our constitutional rights to keep and bear arms in this great United States of America. Thank you.
Next, John Dean. John is a pediatric surgeon, Texas activist, membership director for Doctors for Responsible Gun Ownership, and a great friend. You'll love what he has to say.
Thanks a lot. Thanks for having us here. We really appreciate it. As you know, I'm a fervent opponent of gun-free zones in general, and in hospitals in particular. The gun-free zone, that's kind of my workplace. It's a motivating factor for my Second Amendment rights restoration efforts and my presence here today. 2 years ago, I had the honor of speaking at this meeting on the gun-free zone panel with Masad Ayub and Chris Bird. And I talked about the culture among the hospital administrators being against Second Amendment rights, and that no matter how much you tell them that, you know, hospital physicians and staff should be armed, the corporate culture is against that. In March of 2015, I published an article called "The Unthinkable: An Active Shooter in a Hospital." And we talked about rapid mass murder, and that time is a factor, and that the police response costs lives, and we have to have people on the scene when the active shooter happens. The run, hide, fight can't happen in a hospital. Most of your patients can't run; they're in a bed. They can't hide; they're on unlocked wards and they're in rooms, and they don't have the tools to adequately fight against an active shooter or a terrorist attack. And you know, we're disarmed by both law and hospital policy. And the hospital has a moral and legal responsibility to provide a safe and secure workplace. Their policies actually attract the type of event that their plastic signs are supposed to prevent. And so we need to put pressure on hospital administrators, especially as physicians, to try to end these policies. And last year, I talked about terrorism against hospitals, and that hospitals are soft targets, and that we have an influx of refugees and people coming across the border that is likely to increase our risk of terrorism. Not only are hospitals soft targets, but they're force multipliers. If there's an attack in your city, and then a suicide bomber lights off a vest while the casualty is arriving in your emergency room, you have now doomed every victim of that attack to death, unless they can get to another trauma center. And also, the people in the hospital who work there are now casualties. They do a lot of casualty drills in hospitals, but not a whole lot of we're the casualties. Okay, they don't plan for that kind of stuff. Plus, there's a far-reaching psychological effect on your community if that were to happen. After hearing my presentation last year, Kevin Michalowski actually asked me to write an article in Concealed Carry magazine, and that appeared in July. And I asked several questions. Do hospitals have a legal responsibility to provide a safe and secure environment for staff, patients, and their families? And you better be asking these questions too of your hospital. Do hospitals have a liability risk in the age of terrorism? Is an attack on a hospital a foreseeable event? My answer is yes. Does your hospital have a plan in the event of terrorist attack? In the event of local terrorist attack, does your hospital have a plan to secure your emergency department? Is there a plan to search ambulances and divert traffic away from your hospital so that a suicide bomber or a truck bomb or a car bomb or an ambulance bomb doesn't show up in your emergency room? Would a plan to have trained and armed hospital staff already in place be an advantage and possibly even deter or disrupt the plans of hostage takers? We need to ask our politicians and hospital administrators these questions and hold them accountable. Last year, I asked Alan Gottlieb, what strategy should we have to hold owners of gun-free zones accountable when they disarm us and we are harmed? And Alan Corwin further expanded that, the answer, and I wrote an article called Gun-Free Zones, Who is Liable, and that's on drgo.us. I suggest that you read it. Tennessee Senator Dolores Gresham introduced the Senate Bill 1736, which held the owners of gun-free zones liable. Okay? However, it was gutted at the last minute, and they took the stick out and they substituted a little carrot. What we need to do is to get bills like that passed in each of our states. There's a Texas Senator, Bob Hall, has plans to introduce such a bill. There's also in Wisconsin, Representative Bob Gannon got an act which awards treble damages to owners of gun-free zones. They already have the carrot in Wisconsin. That was in their concealed carry law. So, you know, the bottom line is, sorry about that. This brings us back to hospitals. Without liability reform, hospital administrators and their corporate attorneys will be disinclined to change the status quo. In fact, as things stand right now, it will take a bloodbath and a resultant multi-million-dollar lawsuit for them to see the error in their ways. I pray that day never comes, but we have to prepare for the worst. Thank you all.
John, thank you. Our next panelist, what's wrong with Obama's gun control medicine? Robert B. Young, MD, Distinguished Fellow of the American Psychiatric Association, author and a professor. Welcome, Dr. Robert Young.
Thank you, Mr. Walters. All right. Hi. First of all, for any of you who remember listening to me speak last year, you'll be very pleased to note that I have completely written down my presentation this time. Not only who he said, I'm the chief editor or executive editor or executive chef or something, and the psychiatrist in the leadership of DRGO. And I'm delighted to be here. I'm going to say John skipped over one important thing as he's talking about consequences of attacks on hospitals, et cetera, and who should be liable, et cetera. Which, please look up his article in the USCCA magazine this summer, where he talks about the likelihood of this happening. It is the definitive article on this entire subject, well-researched, and it was a very important thing for the magazine to publish. Now, instead of talking about Obama, which I really don't like doing much, frankly, I'm going to talk more about Timothy Wheeler. You saw him receive the SAF Distinguished Service Award this morning, and it was a surprise to him, although we all knew it was going to happen. But we want you to know a little bit more about his career, because for the past 23 years, he has been indeed far less publicized and far more important to the overall drive for gun rights in this country. Nearly a quarter century, are you hearing me right? Okay, good. Nearly a quarter century ago, he was a young surgeon, young by physician standards anyway, and he discovered that firearm ownership was becoming vilified by the medical powers that were then. Anti-gun, agenda-driven studies shocked him, like the aforementioned Kellerman 1993 New England Journal of Medicine article that claimed that guns themselves create a risk of homicide. I think Sean addressed that very nicely. Don't rent, don't live alone. What are you doing? I mean, come on, right? High-profile leaders in the Centers for Disease Control and medical societies were explicitly stating their intention to get handguns and assault weapons banned, and not only NEJM, but JAMA and other supposedly scientifically based objective medical journals had jumped aboard this bandwagon. They still are there. All of these have been working hand in hand since then, beginning with that era's anti-gun groups, like the Center to Prevent Handgun Violence. Now, Tim Wheeler values his country, its constitution, science, and facts. He already knew that the criminology literature was showing, even then, that the nation's growing private ownership of guns accompanies and likely even contributes to the decreasing violent crime rates we've seen all that time. He decided that some corrective was needed to our profession's bias about what it began terming then gun violence. So Dr. Wheeler founded Doctors for Responsible Gun Ownership that same year, 1993, with Drs. J. David Brayton, Robert Bridges, and Stephen P. Wenger. He's a name a lot of you should know because of his continued activity in his DUF list. DRGO was adopted in 1994 by the Claremont Institute with Larry Arnn, the late Tom Silver, Brian Kennedy, and Professor Dan Palm. With Dr. John Whippler, Tim wrote Keeping Your Family Safe. I can't see this through the microphone for some reason, but I'm glad I don't have that big one. He wrote Keeping Your Family Safe, The Responsibilities of Firearm Ownership. This was published in 2009 and remains in print, and I believe you all have a copy on your desks. Yeah, use it, share it. Dr. Wheeler was then a delegate to the California Medical Association in 1994 and 1995. He brought the evidence in favor of gun ownership there. Oddly, his input literally disappeared from its deliberations. In Dr. Wheeler's own description, my presentations were not allowed to be entered into the record of the debate. 3 times I faxed information supportive of a pro-gun rights view to the CMA House of Delegates Reference Committee in charge of firearms issues. 3 times my faxes were lost. It became clear to me that the California Medical Association was intolerant of honest debate. Medical specialty societies, with their allies in government, began promoting anti-gun positions more and more. And they have been campaigning ever since for ever greater infringements on our right to keep and bear arms. Because of that disdain for science and tradition, the mid-1990s were critical years for pro-gun rights action. In 1994, Dr. Wheeler testified against the Brady II bill at the United States Senate Judiciary Committee alongside Dr. Susanna Gracia Hupp. We all know her. In 1996, with physicians William Waters and Miguel Furia, whose still actively writing on the subject, and civil rights attorney, the great Don Cates. He testified against the CDC's anti-gun advocacy at the House Appropriations Subcommittee that was then reviewing funding for the CDC's National Center for Injury Prevention and Control. The result was the Dickey Amendment, forbidding the CDC to fund work to, quote, advocate or promote gun control. In 2001, he presented the facts at an AMA meeting on gun-related injury, to no apparent effect then. But through much of the past 23 years, leading DRGO has been lonely. He has been the one person consistently, publicly opposing attacks by organized medicine and public health on the presence of firearms in American society, from a truly scientific, medical, and civic perspective. Tim has written hundreds and hundreds of articles, not just for DRGO, but also for national magazines, newspapers, and online publications. Like John Lott, he has also suffered through innumerable interviews for local and national TV, radio, and print media, served on many panels, and contributed to amicus curiae briefs for important Second Amendment cases. These have included Emerson in Texas, 1999, Heller, 2008, District of Columbia, Peruta, 2015 in San Diego, and the Walschlager suits here in Florida in 2015 and 16 so far. He's worked with individuals and organizations, educating and mentoring others about the meaning of the Second Amendment and the proper role of doctors. He's defined and publicized the problems of ethical boundary violations by physicians who push their anti-gun prejudices on their patients. He's found many allies in the gun rights community and impressive support among medical professionals too, including those who can't risk their own jobs by speaking out. I'm in private practice. Along with the public, countless professionals have learned from him about the fraudulent talk about the public health approach to the epidemic of gun violence. And upon Claremont's mission changing in 2011, DRGO found a welcoming new home the next year here in the Second Amendment Foundation. Is Alan here? Anyway, thank you, Alan, and everyone here for that. They're providing the resources that we're beginning, with which we're beginning to expand our reach much farther. Tim has had to think about closing shop as time passed, and he did retire from his surgical practice. But during the past 2 years, others have joined him at DRGO, like Dr. Adine, our membership director, like Dr. Brodale, our director of outreach, like me. And also, I need to mention very specifically Dr. Arthur Prisbinda, who is watching me right now and passing this on through our Facebook feed, who is becoming our project director. He just couldn't be here this weekend for personal reasons, but he says hello to everyone. We can all be very grateful for Tim's leadership opposing the medical establishment's anti-gun superstitions and for showing us how to do that effectively. DRGO is thriving again, all thanks to his establishing and tending it for more than 2 decades. Tim, thank you.
I can't beat that introduction, so we'll just introduce Timothy Wheeler. One thing on the way out, the camera in the back, don't duck from it, wave to it, say hi to it, okay? It's out there for everybody to see. We want everybody to see who's here, all right? I've been promising to say that for a while, and I hadn't gotten around to it. Dr. Wheeler, thank you very much for being here.
Thank you, Mark. And it's so good to be here among friends, and thank you, Rob, for that gracious accolades. And I want to thank Alan and Julianne once again for doing what they do every year, putting on the best networking conference ever for firearms civil rights. and especially for taking on Doctors for Responsible Gun Ownership as a project of the Second Amendment Foundation. We've had a home for several years, and we could not do this work without them. And since we're in Florida, by the way, it's proper that we should also honor the person behind the passage of Florida's Firearm Owners Privacy Act. That's the famous Docs versus Glocks law. You know about it down here in Florida, and doctors outside of Florida know about it too, thanks to this person. She's a former NRA president. She's the executive director of the Unified Sportsmen of Florida. Marion Hammer can't be with us here today, and it's too bad that she can't, because she deserves the highest honors for conceiving the Firearm Owners Privacy Act and seeing it through to enactment as law. As I've said in past conferences, I've talked about it many times, DRGO has been deeply involved in this issue starting from before it was enacted into law and until this year, when we submitted the most recent of 3 amicus curiae briefs. And by the way, while I'm thanking people, I want to thank all of the great attorneys who have helped us out, including most recently Joseph Greenlee in the back there. You heard him talk earlier today with Dave Kopel. Joseph wrote our most recent brief in the Wolschlager case, which is a federal court challenge to the Docs versus Glocks law. So this ain't over yet. Because of Marion Hammer, though, the medical establishment, and not just in Florida, but all across the United States, have been put on notice that they cannot abuse a patient's trust in their doctor to push a political agenda of gun control in the exam room. So, which way's Tallahassee? It's that way, isn't it? Kind of northwest. Thank you, Marion Hammer, for everything that you've done for us. And of course, I can't leave this podium without thanking my team here. These are the 4 medical doctors. Dr. Arthur Pizminda at home, who's watching us right now, along with these 3 up here you just heard. They'll be running DRGO after the first of the year. I'm going to kind of step back. I'll still be around, but I won't be involved in the day-to-day operations. These 4 guys over the last couple of years threw me a life preserver and saved this project, because I wasn't going to be able to do it forever by myself. We have them to thank for a robust and growing national organization that works every single day to defend our civil right to own firearms from public health elites at places like Harvard and Johns Hopkins and other centers for public health gun control. Here's what we're going to do in the future. First, we're going to continue our blog, and to refine our blog, we're adding more authors as we go along. Rob is our executive editor, and that's become his full-time job now, is wrangling all the new writers that we have. He doesn't have time to write stuff himself anymore because of that. So keep looking on our website, DRGO, for twice weekly fresh content in our blog. Second, we're going to develop a referral service to refer you to physicians and other healthcare providers. And now these healthcare providers are not going to be like that doctor up in Ocala who kicked that young mother and her baby out of his practice for talking back to him about guns in their house. These are not going to be that kind of doctor. These are going to be pro-Second Amendment doctors. They're going to be gun rights friendly, and they'll be vetted in advance. And they're eager to help you too. We're in the process of setting that up now on our website. You might even wind up a visit by discussing your favorite handgun loads or your favorite hunting rifles with your doctor. If there are any practitioners, doctors and other healthcare practitioners who are interested in being on this panel, you can email us at info@drgo.us. And thanks to Dr. Arthur Prizminda at home watching us. He's our new project director after the first of the year. He's the guy who thought of this and is implementing it. Last, we're going to establish an ongoing monitoring of Dr. Garen Wintemute's Violence Prevention Research Center out at UC Davis in California. I could spend 30 minutes telling you about how he just recently wrangled $5 million of our tax money away from us out there in California to finally fund his anti-gun research, advocacy research factoid factory at the UC Davis. Well, that's not over yet because we're going to be monitoring his research output and following it closely with some detailed commentary. So finally, I want us all never to forget that this public health attack on our gun rights, on our civil right to own a firearm, is very much in the same vein as what you heard earlier today with the fine panel we had on the UN efforts over a period of decades to take away our guns. It's a culture war, folks. We must never let down our guard, and we must never believe them. We can't give them an inch. And at Doctors for Responsible Gun Ownership, our job is going to be to challenge them, to derail them, and finally to discredit them. Now, we've been doing just that over 20 years now, but right now I feel as though we're just getting started. So thank you all very much.